Hello everyone, welcome back to Believers Science Academy. This is topic of the day. Today we'll discuss a serious health issue. Recently there was a study that found out that if you do not brush your teeth properly, if there are dental cavities, if there are bacteria in your teeth, it might lead to heart attack. Yes, that is a reality. If you do not brush properly, there are chances that it might lead to heart attacks. That is not a myth, that is not a story, it is a reality. So today's topic we'll discuss how not brushing properly, how cavities in your mouth, how cavities in your teeth will lead to heart attacks, will lead to death, okay, or cardiac arrest. So hidden dental bacteria and the sudden heart attacks. The context is coronary artery diseases, that is heart attacks normally are traditionally linked to cholesterol, hypertension, diabetes, smoking, and chronic inflammation. But the recent research suggests that the oral bacteria, particularly Viridum streptococci, the name of the bacteria is Viridum streptococci or streptococci, may contribute to plaque rupture and sudden heart attacks. Okay, so the study was conducted by Tampere University of Finland, examining the coronary arteries of 121 sudden death autopsies and 96 vascular surgery patients. So it is not a research that came out of a thin air. It was a research after the study where they found out in 121 sudden death autopsies and 96 vascular patients. What did they find out? There was bacterial presence in the plaques. The DNA of Viridum streptococci found in 42% of the autopsies and surgical samples. So, in the previous 121 sudden death and 96 vascular surgery patients, they found this bacteria in the plaques of 42% of these patients. But there was a biofilm formation as well. Bacteria formed a hidden biofilm inside lipid-rich plaque cores, evading the immune system for years. First, we'll understand what is this plaque. Okay, so in what is heart attack? Normally heart attack happens when the arteries, this is the artery through which the blood passes. Whenever the blood is not able to pass, whenever the blood is not able to reach the heart, it will lead to heart attack. Okay, what happens in heart attack? This particular artery which is free, which is open for the blood to pass through, is filled by cholesterol, is filled by some fat or fatty acids. As a result, blood is not able to pass through. This particular filling of this artery is called as plaque formation. This is plaque formation. So in most of the persons who they studied, in these plaques there was the presence of this bacteria. The progression, the formation of plaque happens, and this formation starts growing and the growth, and then finally this ruptures. When this ruptures, this plaque ruptures, it will result in blood clotting. When the clotting happens, there is very less narrow tunnel or narrow channel for the blood to transfer to the heart. When the blood is not able to transfer to the heart, obviously it will lead to heart attack and it will lead to failure of blood transfusion to the brain, which will ultimately lead to death. Okay, so that is what happens. When this plaque was ruptured, in this study they found out this particular bacteria in the ruptured parts. Okay, so also it formed biofilm, that is bacteria formed a hidden biofilm inside the lipid-lit black pores or plaque pores, evading the immune system for years. It is not even visible for the immune system. Plaque rupture association. In ruptured plaques, bacteria moved to the outer layer, activating toll-like receptor 2, that is called as TLR2, triggering inflammation that may cause heart attacks. When this inflammation happens, you can see when the inflammation happens, it will spread out. It will result in smaller canal or smaller channel for the blood to pass. Laboratory controls ruled out contamination, confirming the findings. Okay, so this is what the recent research has found out. So first, also we'll discuss about what is the significance of dental care, the link between gum diseases and the heart stroke. So research indicates that gum diseases may increase the risk of heart disease and the stroke. That is, with the gum disease, there is 2% or 2 times higher risks of heart disease in people with gum diseases, and those diagnosed with acute ischemic stroke or brain injury was caused by the blocked blood vessel are more likely to have gum diseases. Okay, see, just because you're not able to brush your teeth properly, just because you're not able to take care of your dental health, it is leading to death, it is leading to cardiovascular diseases. So the possible connection here is the bacteria from the mouth enters the bloodstream through gums, and oral bacteria stick to the fatty plaques that are present on this particular blood vessel, and oral bacteria triggers an inflammation when the plaque ruptures, as a result causing the blood vessels to swell, reducing the blood flow, increases the risk of clots. When the risk of clot happens, and when the clots actually happen, the blood transmission fails. So other things about importance of gum diseases is, and gum disease and your whole health body, or whole body health, over 50% of the adults have some degree of gum diseases, but the impact goes beyond just mouth. That is osteoporosis, that is people with the gum diseases may be at a higher risk of osteoporosis, that is the pores in your teeth. And then stroke, people with the severe gum problem have 3 to 4x higher chances of heart attack. And gum disorders may also lead to Alzheimer's diseases, where the brain stops acting. And then cancer, several studies also shows that strong evidence linking gum diseases with the cancer. And also respiratory diseases, gum diseases can worsen COPD, and may play a crucial role in contraction and pneumonia, bronchitis, or epidemesis. So it is also related with respiratory diseases, and also heart disease, which we discussed already, and diabetes. This particular gum health will also lead to diabetes, and also similar to arthritis. What is arthritis? There is a pain in your joints. So this joint pain can also be caused by this gum disease. Okay, so the gum disease is not only hampering your teeth, it is also hampering your whole body health. Okay, next, so streptococci, a bacteria found in the abundance in oral cavity, can cause the deposition of unwanted clots in the heart walls, leading to ineffective endocarditis. Okay, an infection of the inner lining of heart. So that is why gum diseases or teeth health or the dental health becomes very important for you. What is the implications? The implication is that the antibiotics may fail due to bacterial biofilms resisting the treatment and immune clearance. And the potential preventive strategies is oral bioburden measurement and prophylactic penicillin in high risk individuals are being explored. And the oral health correlation is population studies show good dental hygiene reduces stroke and cardiovascular risk. So untreated periodontal diseases increases heart risk as well. Next, mechanisms is oral bacteria can disperse from the dental biofilms and enter the arteries via micro tears in vessel walls, prosthetic surfaces, that is walls and stents, and lipid-rich plaques, which we discussed already. So similar to ineffective endocarditis, dispersed cells can penetrate deeper tissues, potentially triggering clot formation and rupture, and ultimately cardiovascular disease and heart attack. Okay, so the public health considerations of this particular study. India has high cardiovascular disease rates alongside widespread untreated oral diseases. So preventive measures should be regular dental checkups, gum disease treatment, and prompt management of abscesses. Collaboration between dentist and cardiologist for high risk patients, and also oral swab surveillance after age 40 could help monitor bacterial risk as well. So future directions is the Finnish team plans genetic sequencing of coronary plaque microbiomes. So to find out more about the connection, potential developments of vaccines against this bacterial biofilm formation, and therapies targeting bacterial induced clotting is also on the rise. Highlights the need to consider oral hygiene as part of cardiovascular risk management alongside traditional measures like cholesterol and blood pressure control. So now the heart attack is not only because of fatty acids or cholesterol or blood pressure control, but it is also because of your dental health as well. So the care should be taken on your dental health as well. The future directions is already given. So that is what in the future what you should do is you have to regular dental checkups and brushing regularly and flossing regularly. What we used to teach to the kids to brush properly, floss properly, and take care of your teeth properly and eat properly. That is what you should do as adults as well in order to avoid the heart attacks. So this is today's topic of the day. Very small but very interesting and very informative video as well. If you like the video, then please hit the like button, comment on it, and share with your friends. With this, I will end the video.